like to recognize Senator Lacson.
Mr. Chairman, since there are new oppositors, wouldn't it be prudent to hear first their opposition? Because some of the issues that we may raise could be taken up during the presentation of the opposition, Mr. Chairman. It's just a suggestion, but I'm ready with my questions. Anyway.
Thank you, Senator Lacson. What is the pleasure of the body? Do we allow questions to the nominee first, or call the oppositors, swear them in, and then open?
Mr. Chairman. Mr. Chairman, since
The Vice Chairman is recognized.
Mr. Chairman, if it is at all possible, may I suggest that the remaining oppositors submit in writing their opposition? We will be able to take up their opposition in a caucus that we will be holding immediately after this, in order to deliberate upon the nomination of Dr. Duque. I'm making this suggestion because I'd like to hear these questions first. Mr. Chairman, there are 4 members, 2 senators and 2 congressmen, who have signified their intention. And I am sure they have to ask questions, and I'm sure they've taken a lot of time preparing for these questions. I'd like to hear these questions first, Mr. Chairman, before
I submit to the Vice Chairman, Mr. Chairman.
Thank you, Mr. Chairman.
So there's already a motion, Mr. Chair.
Thank you to the Vice Chairman. Thank you, Senator Lacson. Senator Lacson is recognized.
Thank you. Mr. Chairman, I'd like to ask the appointee, for our continuing education on health issues, can you identify some of the most common diseases that are preventable by immunization vaccines?
There's a lot of them. Good morning, members, the honorable members of the Commission on Appointments. There are several vaccine preventable diseases, and one which I think is very familiar to all of us is the MMR, measles, mumps, and rubella. And then we have the DTP, the diphtheria, pertussis, and tetanus. And we've added to that set the Haemophilus influenza type B vaccine. And then we have the human papilloma vaccine, which is known to cause cervical CA. This is given to women as a protection. And then we have, of course, the hepatitis B and C vaccine, which is known to cause liver cancer. And then, of course, we have the tetanus vaccines or toxoid, flu vaccines. There's the PCV, that's the flu vaccine, the pneumococcal vaccine. And then we have Japanese encephalitis vaccines. And we have, I think I've said all of them, about good to 12 of them, Your Honors.
Even deworming, no?
Even deworming, but that is really more of a medicine that is given. The drug is albendazole or mebendazole. A very benign public health, but very important activity, which has been tainted as well, Your Honor.
Thank you, sir. How much budget do you allocate to the department's vaccine program, vaccination program? 2017 and 2018.
Your Honor, for 2017, a total of 7.1 billion.
17.943.
7.1 billion.
For the purchase and allocation of drugs, medicines, and vaccines, it's 17.943
But this is only for vaccines, Your Honor.
Even
consolidation-wise, I think you're right. It's about 17 billion.
for 2018, Mr. Secretary.
Yes, Your Honor.
No, for 2018.
For
how much?
2018, only for vaccines, 7.4 billion.
But for the whole item, for the whole item,
For the whole item,
drugs, medicines, and vaccinations, That's 15 billion, Mr. Secretary.
About 50 billion.
Yeah,
15,
15.
yes, Your Honor.
15.59. With such humongous budget, is it safe to assume that an outbreak, much less an epidemic, can be prevented or will not occur?
Very difficult question, Your Honor. With that budget, I think the DOH will be able to equip itself to manage, and we cross our fingers that no simultaneous outbreaks occur. But I think at the moment, the health system will be able to absorb, as we have done in the past in the H1N1 pandemic. We did succeed in controlling that, Your Honor.
How do you define an outbreak, Mr. Secretary?
Well, when there's it's an epidemic, uncontrolled transmission of diseases which are mostly vaccine preventable, and that is why I'd like to hammer on the importance of our immunization program, because this is so crucial in arresting and if not preventing epidemics, Your Honor. But should it happen, we're prepared, Your Honor, but I think it is really in the prevention that the efforts must be poured into, more than allowing the disease process to happen and deteriorate, and really will tax heavily on the capacity of our health system to manage all of this. So let's do everything to prevent outbreaks through a very effective, comprehensive immunization program. And given the amounts of money involved, I think we should be able to take advantage of getting the right vaccines in place and giving them on the right time. And that is why this Deng-Vaxia controversy, though unfortunate, it's admittedly affecting the DOH immunization program. But be that as it may, the DOH is doing everything it can to ensure that the reported resistance from the ground with respect to the immunization or the vaccines given by DOH is adequately addressed. And we have given the marching orders to our people on the ground to make sure to extend the targets, to talk one-on-one, the families, do house-to-house campaign for a better vaccine uptake, Your Honor.
I won't touch on Deng-Vaxia anymore kasi bugbog na yung issue. No? I'll be more specific. If you can recall, when was the last time that a measles outbreak occurred in any part of the country?
Well, just in January, Your Honor, there's an outbreak in
Of all places, in Davao City.
Yes, Your Honor, and it's very unfortunate.
And that's affecting 40 barangays, hindi po ba?
Your Honor, that is true, Your Honor.
226 affected children.
Yes, Your Honor.
So,
And,
why is that? Why is that?
Well, we...
Kasi kung preventable, and sabi ko nga, ang laki ng budget for this program, drugs, medicines, and vaccines, bakit nagkakaroon pa ng outbreak?
Well, in Mindanao, there's a mix of reasons why. Some cultural, some tribes would not want their children to be immunized. But lately, there's been a jump in the number of those who refuse their children to be immunized, especially with measles. And the reasons being, number one is the fear that the Deng-Vaxia controversy has spawned. And then number two, of course, is because at the moment that the vaccine was going to be given, either the child was sick, and that's a contraindication to giving the vaccine. And then third would be some just outright rejection by parents with no very well-defined justification or reasons, Your Honor.
The point that I'm trying to drive at, Mr. Secretary, is isn't the DOH giving MMR vaccines routinely
Yes, Your Honor.
to the children, no?
Yes,
in all
Your
parts
Honor.
of the country. So ang tanong ko, bakit magkakaroon ng outbreak? I don't think, or I don't see any justifiable reason why an outbreak would occur kung routinely binibigay dapat ito. And there's budget for that, di ba? Sabi ko nga, malaking masyado yung budget.
That's right, Your
So
Honor.
why, I want an explanation kung bakit dapat magkaroon pa rin ng outbreak in spite of a routine practice of giving vaccines to the children.
Your Honor,
Is this something, has this something to do with your supply chain, Mr. Secretary?
well, I don't have reports to that effect, Your Honor, of insufficient or inadequate stocks of vaccines, Your Honor. But I was just told that truly the herd immunity that we all would like to achieve is quite difficult in certain areas because, again, let me just underscore earlier what I said. Some tribes, some indigenous peoples with some traditional religious beliefs, they have not really appreciated the public health value of the DOH immunization program. And then number two is, of course, the mobile and transient populations. Some of these populations are peripatetic. They're in one place now and then they're in another place. And that could be a nidus, Your Honor, or a focus for an outbreak.
I'm not referring to the supply of medicines, but the supply chain, Mr. Secretary. Is there a database of all the medicines being distributed to the different parts of the country? Kasi maraming reports, Mr. Secretary, na nabubulok, nag-expire yung mga gamot in some parts, pero oversupply naman or nagkukulang naman doon sa mga ibang lugar. So there must be something wrong with your supply chain. And there must be something wrong with your monitoring system. Baka wala kayong database, Mr. Secretary.
Well, I agree, sir, that the supply chain is one area. When I just assumed my position in November, I was appalled by the data that were given to me, where for 1 year there had been an overstocking of medicines.
That's
and
exactly
one
my point,
particular,
Mr.
yes, sir,
Secretary.
the losartan, for example, 1 year of supplies, and then I heard that there was an attempt to buy again for the next year, and I said, how can you do that when your stocks aren't moving? So I said we need to
Is it-
have the governance mechanisms
Please
in
look
place.
into that, Mr.
We will do
Secretary.
that. It's been my priority, Your Honor, because I will not allow it, Your Honors, that we have overstocking of medicines where on the ground I get feedback that there are no medicines. And this is really, to me, appalling. And I will not allow this, Your Honors, and I give my word to you.
Is there an undersecretary in charge of just monitoring the data or the supply chain of medicines? Dahil hindi ba dapat ito first in, first out? The first that you bought should be the first that you should distribute para magamit, para maiwasan yung oversupply, overstocking, and expiration of medicines.
I agree.
Meron po bang in charge na undersecretary rito?
Meron po tayong undersecretary
Can you
who's
please
in charge.
identify who is that
Well, she's USEC Carol Taino. But she has already begun putting in place because she's also a newly promoted official of the DOH, and she has already hired a consultant in supply chain and logistics management, precisely to institute the much-needed reform in that area of our managing our drugs and medicines. Or at least the
And
supply.
how close is your coordination with the local government units? I understand the local government units have their local monitoring board, yung drug monitoring board in place. And if there is no coordination between the DOH and the local government units, magpe-fail talaga yung supply chain natin, because we all know that it is the local government units that are more or less knowledgeable kung ano yung situation sa kanilang mga localities, hindi po ba?
It behooves upon the DOH, Your Honor, the regional directors, to touch base with their local government unit counterparts, because I think the first fundamental step is to ensure that there is needs assessment, needs analysis, so that the DOH can now respond to those needs and identify what medicines, for example, is needed in, say, in Mindanao or in Visayas or in the geographically isolated and disadvantaged areas or GIDA areas. So I believe that there is a coordination, but I don't know how effective the coordination had been. But I reassure this body, Your Honors, that we will make sure that the needs assessment is done and really identify the much needed drugs and medicines, and we will be governed by the results of the needs assessment, Your Honor.
Do you have data as to how much drugs, medicines, and vaccines are wasted due to overstocking, Mr. Secretary?
Meron tayong ballpark estimate. More or less. Guess.
10% wastage. Allowable wastage.
Well, according to my staff, there's about roughly 10% that goes to wastage.
10% of 17 billion, Mr. Secretary, is 1.7
7 billion, yes,
Or
Your
what-
Honor.
That's 17.954 billion, or 17.953. In other words, almost 18 billion. So we're wasting 1.8 billion pesos worth of medicines, drugs, and vaccines.
It's not allowable. Under my watch, we will not allow this, Your Honor. So we will make sure that the proper systems are in place. The logistics and supply chain reforms must be put in place ASAP, Your Honors.
Meron ba kayong authorized, Sa amin kasi sa military, I just asked the chairman, sa mga field exercises, meron kaming 5% casualty. We're authorized to have 5% casualty. Meron ba kayong allowable wastage?
Well, the acceptable benchmark globally is an allowable 10% wastage, Your Honor.
That's a bit too much, Mr. Secretary.
Yes,
Maybe we
especially
can
if
do
the
something.
Yes, sir. Yes, sir.
And my suggestion is you strengthen your supply chain, you strengthen your database, and you strengthen your monitoring system. That's
Yes.
that's the reason why I asked earlier, kung meron kayong particular undersecretary in charge of just monitoring the supply of drugs, medicines, and vaccines, and the distribution.
We will strengthen, Your Honor.
Kasi in this day and
our-
age of computer technology, madali-dali na siguro, Mr. Secretary.
Yes, a real-time database
Yes, real-time.
management, Your Honor. We will do that, Your Honor, as soon as ASAP.
Kasi ang pinaka-importante, wag magkaroon ng outbreak.
Oho.
Especially itong preventable diseases. And to me, there can be no justification na magkaroon ng outbreak. 10 deaths in Davao City. Very recent ito, January 22 to 24. Imagine 40 barangays affected by just measles. And measles is easily preventable sa immunization. I'm not trying to lecture, but I'm concerned because a huge budget is involved in this program of the DOH, and this is a very common complaint, especially from LGUs. While the function is devolved, yung pondo na iwan naman sa central office. So they're helpless practically. And if they're not involved in the monitoring and stocking of drug supplies, medicine supplies, and even vaccines, then magkakaroon ng disconnect, hindi po ba?
Exactly, sir.
Pag pumunta si Juan de la Cruz do sa mayor, dahil nanggaling na sa DOH at sinabihan na siya na pumunta kayo sa mayor dahil devolved na yung function na yan. And when they go to the mayor, At sasabihin naman sa kanila, devolved na nga pero yung pondo nasa kanila. So bumalik kayo doon. Ganun po ang nangyayari. So there's really a disconnect between the central government and the local government units. But if there's close coordination between DOH, the department itself, and the LGUs, siguro hindi mangyayari hindi tayo magkakaroon ng outbreak, hindi tayo magkakaroon ng wastage of medicines and drugs and vaccines. Hindi rin siguro, hindi magkakaroon ng outbreak. Anyway, I will yield the floor to the other members of this commission kasi I'm sure they are also anxious to answer questions. Thank you, Mr. Chairman.
Thank you, Senator Lacson. This will be the order of asking questions based on their earlier manifestations. After Senator Lacson, we will have the Honorable Congresswoman Nene Sato, and then after her would be Congresswoman Sandy Ocampo, and then Senator Grace Poe, Senator Pacquiao, Senator Risa, Senator JV, and Senator Villar. But before we